What are the State of New Hampshire benefits programs for individuals and families? Presented by Granite State Independent Living's Financial Planning and Benefit Services. What kinds of programs does the State of New Hampshire offer to individuals and families? There's food stamps, also known as the SNAP program. There's the Medicare Savings Program. There's TANF and FANF cash assistance and APTD cash assistance. Looking for Medicaid? Check out the Medicaid for Individuals and Families presentation. What are food stamps? Also known as the Supplemental Nutrition Assistance Program, or SNAP, this program offers nutrition assistance to millions of eligible low-income families and individuals. There are income limits which vary depending on your household size, and a resource limit of $3,250. Food stamps will be the first benefit affected by earnings. The basic rule is for every $100 in additional income, you lose $30 in food stamps. How do I learn more about food stamps? For more information regarding eligibility, you can talk with your case manager or the local office of the Department of Health and Human Services. You can also go to the food stamp calculator. What are the Medicare savings programs? These are most commonly referred to as QIMBY or SLMB. They assist low-income disabled individuals who are eligible for Medicare by paying for some or all of the associated costs of Medicare. There are income and resource limits. The resource limit for an individual is $7,160, and for a couple it's $10,750. What is Qualified Medicare Beneficiaries, or QIMBY? The QIMBY program provides limited assistance to help pay your Medicare Part A and Part B premiums, your Medicare deductibles, and your Medicare coinsurance expenses. To be eligible for assistance under QIMBY, you must be entitled to and enrolled in Medicare Part A insurance as verified by the Social Security Administration. QIMBY assistance is determined without regard to eligibility for any other public assistance program, including Medicaid. What is Specified Low-Income Beneficiaries, or SLMB? The SLMB program provides limited assistance to help pay your Medicare Part B, or Supplemental Insurance Program, premium. To be eligible for assistance under SLMB, you must be entitled to Medicare Part B insurance as verified by the Social Security Administration. SLMB assistance is determined without regard to eligibility for any other public assistance program. There are two types of SLMB eligibility, SLMB 120 and SLMB 135. And these are the program income limits. This is for a household of one. For each additional household member, add $335 to the income level amount for QIMBY, $402 to the income level amount for SLMB 120, and $453 to the income level amount for SLMB 135. Are there any deductions for QIMBY-SLMB? SSI does not count as an unearned income for QIMBY-SLMB. If you have unearned income like SSDI, you will receive a $20 deduction. If you also have earned income, then you will receive a $65 deduction, and then half of your earnings will be counted. What is TANF, FANF cash assistance? TANF is temporary assistance to needy families and financial assistance to needy families. The types of TANF, FANF cash assistance are the Family Assistance Program, the New Hampshire Employment Program, Families with Older Children, and Interim Disabled Parent. This program provides cash assistance to needy families. For more information on how TANF, FANF cash assistance would be impacted by earnings, you should speak with your case manager at Health and Human Services or talk to a work incentive specialist. What is APTD cash assistance? APTD stands for Aid to the Permanently and Totally Disabled. For this program, you must be between the ages of 18 and 64, have a medical condition expected to last at least 4 years or result in death, not be earning over SGA of $1,070 gross per month in 2014 at the time of your application, have resources below $1,500, and have income below the standard of need, which is $735 for an individual and $1,083 for a couple. What is A&B cash assistance? Aid to the Needy Blind, or A&B. It's available for individuals of any age who are legally blind. The other eligibility requirements are the same as for APTD cash. Please note that parental income and resources can be a factor for children under the age of 18 on this program. What are the work incentives for APTD A&B cash assistance? There's a general disregard of $13 for an individual and $20 for a couple. If you are receiving cash assistance to go to work, Following exclusions apply. There's an earned income disregard of $20. Then they count $30 or half of the remainder, whichever is smaller, and an employment expense disregard of $18 or the actual expense. The EED is different than impairment-related work expenses, and different things qualify as EED deductions, such as Social Security and federal withholding taxes, transportation to work and to childcare if needed for work, childcare cost if needed for work, special clothing costs, and other mandatory deductions. Want more information? You can view the rest of the videos to learn more. You can contact Granite State Independent Living for assistance. You can visit the New Hampshire Work Incentive Resource Center for resources. You can contact Social Security Administration or New Hampshire's Department of Health or Human Services. If you are connected with an area agency, a mental health center, or vocational rehabilitation, you can contact them for more information and assistance.